Good morning, everyone. I'm Mr. Piyush. I'm a host for today. I welcome each and everyone for today's Sadgun Sang. This is 249th virtual webinar. Today's topic is oral health awareness, a key to overall well-being. The host for today is Dr. Rensila De Silva, founder head dentist, Dent Health. Vulture innovation by Dr. Sundar Kataria. Invoking the blessing of deity, chanting of Gayatri Mantra. Introduction of speaker. Presentation by Dr. Rensila De Silva. Question and answer session. Closing session. Dr. Sundar Kataria, Chairman and Managing Director, ICS Group Companies. Sadgun Sang conceived or led by Dr. Sundar Kataria, driven with a mission to elevate the quality, safety, and environment awareness level of industry. Sadgun Sang is a series of educative, informative events aiming to eliminate professionals on possible solution to current issues and industry and economy. Designation and organization. Chairman, Managing Director, International Certification Service Private Limited. Academic qualification is Mechanical Engineer, AMIE. Honorary Doctorate, Business Management. Experience, nuclear reactor. He started his career in building Indian first nuclear power plant at Rawabhatta, Kota, Rajasthan. Oil gas, EIL. He contributed in developing India's first oil gas field at Bombay, high since its inception. DNV. He was the head of industry and offshore development with DNV for 2 decades. ICS. He's founder of first Indian conformity assessment and inspection body known as International Certification Service Private Limited, which is a provider of total quality solution under single umbrella with a wide spectrum of service. His achievements and awards. Lifetime Achievements Awards of NACE Corpon received several national as international awards. I request Dr. Sundar Kataria to virtual inaugurate today's session. Please join us.
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः.
Introduction of the speaker. Designation as organization, founder as head dentist at Dent Health, academic qualification, Bachelor of Dental Surgery from Bharati Vidyapit Dental College, Navi Mumbai. Her experience is continued dental education through specialized course in restorative dentistry, cosmetic treatments, oral surgery, dentures, and modern endodontic techniques. 8+ years of experience. ICS is pleased to so I welcome you, ma'am. Hello.
Hello.
Am I
Hi,
audible, ma'am?
Piyush. Good morning. Yes, you are
Very good
audible.
morning, ma'am.
Good morning. Thank
Over
you
to you,
for the
ma'am.
introduction, Piyush.
Myself, Piyush. I'm working in ICS technology. Yes. Ma'am, can you share me your PPT?
Yes, sure. I'm sharing the screen now.
Over to you, ma'am.
Thank you, Piyush, for the introduction, and a very good morning to all of you who have joined for today's session. I'm Dr. Ansela De Silva, a practicing dentist, and I am someone who firmly believes in not just treating patients when they come to me with their problems, but I also believe in educating my patients so that they can improve their quality of life. And that is why I was very fortunate to have been offered this lovely opportunity where I could share my insights with you all on oral health, why it is important, and how it affects our overall health as well. Now, with over 8 years of experience, what I have seen as a practicing general dentist is that most people come and visit a dentist only when they have problems, when they have tooth pain, when they cannot chew their food, or if their front teeth are looking really ugly and they don't like the way it is looking. Very rarely do I find patients who come to me and tell me we have come for a routine check because we want to ensure that everything is in a good working condition. So, this basically shows our attitude of neglect towards oral health, and we don't really take care of it till matters are not bad. So that is something that I want to change today, where we also prioritize our oral health like we would take care of any other part of our body, like our heart, our lungs. That is something that scares us, right? So this also is something that should be prioritized so that you don't just have a good healthy mouth, but you also have a good body, healthy body in general. So, for us to be able to understand oral health awareness, we have to first understand what all is included in oral health and what oral health is. So, as lay people, when you say oral health or when you speak about dental health, the only thing that comes to our mind is teeth, that we have to have good teeth, white, sparkling teeth with no cavities. That's it. Nobody thinks beyond teeth. So the mouth is more than just your teeth. The mouth also includes other parts, like you have your gums, your tongue, you have your cheeks, your palate, lips, and of course your bones, which are covered with your gums, muscle, and skin, which we cannot see, but that is the foundation to our mouth. Like your building has a foundation which you cannot see, but you know that if the foundation is not good, everything else collapses. Your jawbones are just like that. So when we say oral health, good oral health, it doesn't just mean that your teeth only should be in a good condition. It means that all these parts that I have just mentioned to you should be in good function and in optimum health. Because remember, our mouth is like the gateway. We use our mouth to eat, to chew food. We use our mouth to speak. So, if anything goes wrong with any of these parts of our mouth, it means we are unable to chew our food, we are unable to speak. And if we cannot speak, do you think you can socialize with people? Do you think you can talk to people? Obviously not, right? So that also takes a toll on our social life. So oral health is basically important for good functioning of your body and also to maintain a good quality of life. So why oral health is important? Like I said, your mouth is more than just what it appears to be. It's more than just a smile. It's a gateway to your overall health and well-being. So, I'll just give a very basic idea of how digestion works. So, whenever we eat something, digestion doesn't start when the food reaches your stomach. Digestion starts the minute you put the food into your mouth. So, when the food goes in our mouth, we start chewing on it. As we chew on it, the saliva in our mouth mixes with the food. This saliva mixing is something that is very crucial because that helps in the smooth digestion once the food enters into the stomach and the intestines, because that is where all the nutrients take up begins. Now, when you cannot chew properly, that is, if you don't have good teeth, if you don't have good gums, and it's in a very unhealthy state, obviously you cannot chew. If you cannot chew, obviously there will be no nutrition that will be taken up from your food. Your digestion process will not happen properly because if you can't bite, there is no saliva mixing with your food. There is no saliva mixing, there will be indigestion problems, there will be bloating problems, gas problems, and many other issues which we will discuss in detail in the latter parts of today's discussion. Second is it affects speech and communication. Like I just mentioned, if you don't have some teeth, the pronunciation of words doesn't come clearly. You have difficulty talking, the opposite person has difficulty in understanding what you are saying. So all these problems also come into effect. Third is it contributes to confidence and mental health. If you have a good set of teeth, which is healthy and good looking, not just good looking, health is a very important thing to remember here. If this is not in place, you obviously lack the confidence to stand in front of somebody, talk to them, socialize with people. You go into isolation. This isolation affects your level of confidence, and with long term low confidence, it is also seen to affect mental health. People go into borderline depression, they isolate themselves from society, which is not good for us as human beings because man is a social animal. Man needs to interact with other people to grow. So that is another important point why oral health is important. And obviously, the final and the most obvious point, nobody wants pain in their life, right? Everyone wants to be pain free and free of disability. So, having good oral health helps keep you pain free. Now, people generally, like I said, tend to take dental problems or oral health problems for granted. They feel like it's just the tooth, it's nothing major, it's not like you're getting a heart attack or something like that. But this thought has to change because once we dive into these statistics, you will understand the severity of oral problems, oral health problems, and how widespread they are and how badly they can affect us. Now, as per the World Health Organization, 3.5 billion people worldwide are affected with oral diseases. That is 350 crore people are affected by oral diseases. That is how widespread oral problems are. That is how prevalent they are. So this is not something that can be taken lightly. And the most common non-contagious disease in the world is dental caries or tooth decay, as we commonly know it as cavities. So it is a genuine burden on society when we look at it in terms of the number of people affected by this. And periodontal disease is the leading cause of tooth loss. What is periodontal disease? It's nothing but disease of your gums and of your jaw bones that makes the tooth support less, and people tend to lose their teeth because of this. Now, diving into some more statistics, as per the World Health Organization, over 90% of the world's population will be affected by oral disease or dental disease at some point in their life. That is huge. Okay. So this could be from something as small as a small cavity. It could be something as severe as oral cancer. So almost 90% people during their lifetime will encounter one of these issues for sure. That is how common dental diseases are. Now, if we go to people aged between 65 to 74 years, it is estimated that about 30% of this population all over the world do not have any teeth by the age of 65, which is a very sorry state because not having teeth means you're not able to eat properly, means you lack nutrition, and your overall health again gets affected or ruined because of this. Another very important detail to concentrate on over here is that oral cancer is the third most common cancer in the world, and most individuals affected by oral cancer are male compared to females. So this slide basically is to only understand the gravity of the situation, to show how prevalent oral problems are, that it's not a rare thing, it's a very common disease. However, the positive here is, as much as all of this sounds scary, or the fact that it is really something serious that we have to concentrate on, one should also understand that all these things are pretty much in our control if we take preventive measures, if we are seeing our dentist regularly to help keep things in check. So, as much as this is a global burden, it is very much something that can be controlled and optimum health can be achieved. So now that we've got an overview about what oral health is, what the importance of it is, and how prevalent it is as a disease in society, we need to understand what are the factors that contribute to oral diseases. Because till we don't understand this, we cannot work on improving our habits or our lifestyle to ensure that we have a good quality of life. So, the first factor that contributes to oral health or influences oral health, I'm sure it is very obvious and most of you must be aware of it, is your diet. What you eat is what makes you and is what makes your health. The same applies for your oral health also. Everybody already knows that sweet food is not good for your teeth. That is absolutely correct. But it's not just sweet food, acidic foods also, meaning sour things like your excessive citrus fruits, excessive wines, grape juices, sour candies, all these things tend to affect your oral health too much. Now, how diet affects our teeth? I will just give you a very quick overview of it. So, whenever we eat something, it's not necessary only sweets or acidic food. It can be anything. It can be your roti, sabzi, dal, rice, whatever goes into your mouth. And the minute you start biting it or chewing on it, we have some bacteria present in our mouth. And I'm sure everybody is aware of this, that there are bacteria in the mouth. Now, the minute we eat, what this bacteria does is it gives out an acid in the mouth. Now, acids, as we all know, it either burns things or it dissolves things. Now, in the mouth, this acid does not cause any burns, but it dissolves the tooth. Enamel is the outer layer of the tooth. So, when the acid levels go up, the enamel starts getting weaker. If the enamel is getting weaker, obviously your whole tooth is getting weaker. And when the tooth is getting weaker, it is more prone to developing cavities. Every food item that we consume does this. Sugary foods and acidic foods make it worse. Okay, they increase the rate at which the damage is happening. So, if your diet is in control, if you're consuming less sugar, less acidic foods, it makes you relatively healthier and relatively decreases the chances of you developing cavities. Why I'm saying the word relatively? Because it never makes it zero. There is always a slight chance of developing cavity. It's just that you can resist it to a certain extent if your diet is in check. Second is oral hygiene habits. What is oral hygiene? Brushing twice a day, flossing once a day, gargling after each meal. This is your basic oral hygiene. Now, when we don't keep our mouth clean, dirt forms in the mouth. So, this dirt is what we call as plaque and tartar. Plaque and tartar again have bacteria in it. What will bacteria do? Like I just mentioned, it's going to give acid out. So that in turn again makes the tooth weak. makes you more prone to developing cavities. Other than just your cavities, poor oral hygiene, meaning the dirt or the plaque that collects in your mouth, can cause infection of the gums. And if infections of the gum happen or the bone happens, this tends to spread to other body parts also. And I will be discussing this in detail about how it affects the other body parts in the subsequent slides. Next, again, something that I'm sure all of us are aware about, that is tobacco and alcohol use. Why? They stain your teeth, you get all these brown marks on your teeth start breaking down and wearing away. And the most important thing is that these increase the chances of you developing oral cancer. Next, we have genetics and systemic conditions. What does this mean? It simply means that some people inherit genes from their parents such that it makes them by default more prone to developing cavities. So, although they are taking good care of their teeth, they are brushing well, they are regular with their dental appointments, they still keep getting cavities frequently. So, in such cases, it's not the person's fault, it's just that their genetic makeup is such that they are more prone to developing any problem in the mouth. And systemic conditions, meaning any other general medical conditions like your diabetes, lung infections, liver problems. All these people also become more prone to developing oral health issues. And the last factor that we have is access to dental health. So this I don't think is much of a factor in cities where we have good access to medical care or dental care. This seems to be more of a problem in remote areas where there is not good enough healthcare facilities available to people. And even if there are facilities, they are not equipped enough to provide quality care as per what recent standards are. So access to dental care, yes, it is a major issue, but this applies more to rural areas than to those dwelling in cities. Now we will come to the important part of our presentation for today, that is understanding how your oral health is connected to the rest of the body. So there is one simple funda which applies to most of the body parts. Of course, for some body parts, it is a little different. In the next slide, I will be explaining those different portions or different mechanisms in detail. But I just want to make the basic concept clear so that as non-dental professionals, you all understand how this mouth health is linked to the rest of your body parts. So it's very simple. We know bacteria is in the mouth, and we also know that bacteria can cause infection. Now, when people have infections in the mouth, like gum infection, bone infection, cavities, for a very long time, which are not treated and are not addressed, this bacteria from the mouth slowly starts spreading to the other body parts, and it spreads to the other body parts through your blood. We have veins all over in our body. We know that all the veins in the body are interconnected. So obviously, if it is interconnected in the whole body, that means it can carry something from one part to the other part, right? So that is exactly what happens. Your bacteria from your mouth can be carried to your brain. It can be taken to your heart. It can be taken to your lungs, your joints, your legs, basically anywhere in the body. This is the basic funda of how your mouth can affect the rest of your body. We basically call the mouth as the window to your overall health, because starting from here, everything else gets affected. This, what I have explained to you, that is the bacteria spreading from the mouth to the other body parts, is what we in our technical terms call as the chronic inflammation link. Chronic meaning something that is there for a very long time and something that is not attended to. Inflammation is basically a sort of a irritation in the entire body where your body is not in a healthy state. Better way to explain inflammation is, suppose you have a fall and you hurt your hand. You will notice that the hand becomes red, it becomes swollen, it becomes painful. So that redness, pain, swelling is what we call as inflammation. So imagine something like that inside your body that you cannot see. So your body is having that mild swelling, that mild redness, mild irritation, mild pain because of all of this. Now, some of the most common systemic conditions. When I say systemic conditions, I mean other medical problems that are associated with oral diseases. The most common and the most aggressive out of all, I would say, is diabetes. Then we have heart disease, we have stroke, we have respiratory infections. That is basically anything to do with your breathing or with your lungs, pregnancy outcomes, and even Alzheimer's. So, this is how your mouth is connected to the rest of your body. You can see several conditions that are listed on the screen. All different body parts, all different body systems. So, now I will give you a quick brief on how the mouth is connected with this body part, how it happens, and what can be done to control it. Number one is we see Alzheimer's and dementia. So remember the initial link that I explained, that bacteria from the mouth goes into the blood. From the blood, it goes to the different parts of the body. So in Alzheimer's, what happens is that bacteria from the mouth goes towards the brain. When it goes to the brain, it creates a sense of irritation or inflammation in the brain, which affects the brain cells. Now, brain cells we all know are responsible for retaining memory, for identifying things, color, etc. Basically, everything that your brain is capable of doing is controlled by your brain cells. Now, when these bacteria are taken to the brain, it affects these very cells, which is the foundation blocks of your brain. That over time keeps worsening and eventually could lead to Alzheimer's or dementia, both of which are to do with memory loss. And it is a study was done that those who have gum disease for prolonged periods, which is unattended for more than 10 years or so, they have a 70% higher risk of developing Alzheimer's or dementia. So, anyone with poor oral health is more at risk of developing these life threatening conditions. Second, what we have is stroke. Stroke basically is when there is less blood reaching the brain and you get a paralytic stroke and you lose function with either one side or both sides depending on the type of stroke that you have got. So what happens in this is same mechanism. The bacteria from the mouth goes towards the brain, but over here, slightly different thing happens, which is your bacteria will form small plaques. What are plaques basically? It's like a small collection of tiny masses which forms a blockage in your blood vessels. Blockage we mostly associate with the heart. We say, right, 80% blockage and 90% blockage. So these kind of blockages can also happen in the veins which carry blood to your brain. So, when this bacteria forms blockages in these vessels, blood doesn't reach the brain. And when blood doesn't reach the brain, it means that oxygen is also not reaching the brain, and you develop a stroke. And people with gum disease are 3 times more likely to die due to strokes than people with relatively healthier mouths. Next, we move to respiratory disease. Respiratory disease is basically anything to do with breathing problems, anything to do with the lungs. Again, bacteria goes into the blood reaches the lungs, makes the person more prone to developing conditions like pneumonia or any other upper respiratory tract infections where the person may have difficulty breathing, they may have cough and cold all the time. So this is again something that needs to be focused on. Next, that is the fourth condition that we are seeing is heart disease, something that is very, very important and very commonly seen amongst people in today's times. We even see young individuals getting affected by heart disease these days. In earlier times, we used to only see older individuals suffering from heart attacks or cardiac arrest, but now it can happen to anyone. So one of the major reasons why this happens is poor gum health. So your bacteria from the gum flows to the heart and it can affect the functioning of your heart. And people who have poor gum health are twice more likely to die from a heart attack. The next condition that we see is obesity. Now with obesity, of course, the same funda applies where you have bacteria from your mouth going to your overall body, causing inflammation and irritation. But there are two other things which are slightly different in obesity. Number one, we mostly see obese individuals to be people engaged in habits of overeating. I'm not saying everybody because there are certain medical conditions also which make people obese even if they don't eat a lot. One common is when the thyroid is affected, that is hypothyroidism. Sometimes these individuals don't eat a lot of food but they are yet very obese. So this doesn't apply to that, but I'm talking about people who are obese because they don't have a good diet. Now, in them, what happens is what do these people mostly consume? They mostly consume deep fried things, they mostly consume sugary sweet things or excessive carbohydrate consumption. Now, when you are having so much sweet, again, let's go back to the previous slide. Like I said, more sugar, more acid, more attack on your teeth, more attack on the teeth, weaker teeth, hence cavities. So this is something that happens in obese people. Another way in which obesity is connected to oral health is, like I said, people who have the habit of overeating and generally eat a lot of fried stuff, a lot of sweet things. So mainly fried things. What happens is even you and I, we experience this. I'm sure on and off. When in a particular on a particular day, we probably overindulge in eating a little too much of unhealthy or deep fried food, we do experience acidity sometimes or a slight burning sensation in the chest. Now imagine somebody who is almost every day having this kind of a diet. Don't you think they will have long-term acidity problems? Of course they will, right? So when there is long-term acidity, that acid comes from the stomach and it reaches the mouth. When we are sleeping at night, we are in a horizontal position. This acid comes right from the stomach, stays in the mouth, it coats all the teeth. Again, this is another way of acid attack on the teeth. So this also helps in weakening the tooth and making the person more prone to tooth problems. Another thing related to obesity is we see, like medically, we see most obese individuals also have diabetes. Okay, very common link obesity, diabetes, and gum disease. Now, when an individual develops diabetes, we know about all the other issues that sugar shoots up, it can affect the eyes, it can affect the nerve senses, etc. etc. Everybody talks about this. What nobody talks about is how it affects your mouth. So when we have diabetes, our body's immunity slightly goes down a little. Now, when the immunity goes down, we know that you become more prone to developing infections. And if you get an infection, you can't fight it well enough. Infection को ठीक होने में बहुत time लगता है. So what happens is these people catch an infection in the mouth, a gum infection, bone infection. This then keeps spreading throughout the body. It damages the bone very aggressively. So your bone levels keep going down. As the bone levels keep going down, your teeth become weaker and weaker and weaker, eventually leading to tooth loss. So obesity, diabetes, and gum disease have a very strong interrelation and a very aggressive interrelation, something that we see very commonly in our Indian population. So this is something that we need to focus on. Also because diabetes worsens bone disease and gum disease, and sometimes people who have gum and bone disease and initially do not have diabetes develop diabetes because of poor oral health. Next, we come to sexual and reproductive health. This affects both men and women equally. How it affects women is hormonal balances get disrupted a little. So, when there are hormonal imbalances, if a woman is trying to conceive, conception becomes very difficult. If she conceives, then there are possible complications that can come during pregnancy, that is premature birth. The child will be born with a low birth weight. The mother develops a lot of pain and gum problems and gum bleeding during pregnancy. And why this is more important is because during pregnancy, treatment cannot be done at any point because it can affect the child. So, treatment during pregnancy can only be done during the second trimester. In the first and third trimester, treatment cannot be done. So can you imagine the plight of the pregnant woman if she develops a gum condition but she can't even seek treatment for it? So one very common thing that I advise couples who are planning for a pregnancy is they both first need to get their oral health fixed. Because if you have a healthy mouth, all of that helps in a smoother pregnancy. And when I say oral health fixed before pregnancy, not just the woman but also the man, because sperm quality also gets affected with poor oral health. Either the sperm count becomes less, or if the sperm count is maintained, the sperm quality is poor. Obviously, that is also going to take a toll on the whole conception process. So, this is something of importance again. Next, what we are coming to is cancer. We all know that tobacco, alcohol, be it tobacco chewing, like your supari, betel nut, whatever, and tobacco smoking, BD, cigarette, hookahs, e-cigarettes, vapes, all this can cause cancer. Besides this, there are also other reasons that can cause cancer. That is viral infections. Okay, there is a virus known as HPV, human papilloma virus. That is also something that can cause oral cancer. So all these things do take a toll. We can control our habits. Time to time, monitoring and checking can help keep it in control and prevent development of cancer, or it can be detected easily. And also, it is seen that those with gum disease are more likely to develop cancer than those with healthy gums. Diabetes, I've already discussed with you all how it affects the overall health. So I won't get into it again, it will be a little repetitive. And the next thing that we see is osteoporosis. Osteoporosis, as we know, is weak bones. So with weak bones, what happens is that affects the jaw bones also, because of course we even have bones in the mouth. So what happens when the mouth bone gets weak is the teeth also become weak, they become loose and they fall out, so it can lead to premature tooth loss. When there is tooth loss, we go back to the same cycle. You're unable to chew or bite your food properly, digestion problems start, socially you're affected, your confidence gets affected, so all of that comes into play. Also, another thing to make note of in osteoporosis is because the gum is in a weak condition, of course, we can replace teeth if the teeth are lost, but replacement also becomes challenging. We cannot just go about with the normal procedures that we do in people who do not have osteoporosis. We have to do extra things to make the bone in a healthy or in a fit condition to be able to take up whatever artificial replacements we give the patient. So this is something that is very important, and mostly osteoporosis tends to affect women once they cross their 40s. So this is something that women really need to make note of and pay special attention to, because you all are more likely to develop it than your male counterparts. And the last thing that we see is rheumatoid arthritis. So, again, a quick idea on how this works. Same cycle. Bacteria from the mouth, in this case, goes through the blood to your joints. Now, when this bacteria reaches your joints, it starts attacking your joints. And your immune system, in turn, to fight the bacteria, starts attacking your joints too. So, patients then develop pain in the joint, swelling in the joints. If the knee joints are affected, difficulty to walk. If your finger joints are affected, you will find it difficult to hold things, or you will just have frequent pains even with the most basic activities that we do in our day-to-day life. So again, the same interrelation like diabetes. People with gum disease are more prone to developing rheumatoid arthritis and vice versa. One thing that we observe with rheumatoid arthritis is that the pain can be very severe in the joints. But sometimes something as basic as going to your dentist, getting a routine check and a routine cleaning done relieves some or most of the joint pain. So this makes the connection between rheumatoid arthritis and your gum disease even more stronger. So again, something that we need to focus on. Maintain good gum health. If you are somebody who has very severe rheumatoid arthritis, because it can help relieve a lot of that pain and discomfort that you are experiencing. Now we will come to some of the most common oral health problems. To understand what these are, what happens if we don't treat them, and how it can affect us. Like the previous slide indicated, the most common non-contagious disease in the world is dental caries. That is nothing but your decay or your cavities. We know how it starts. I just explained it to you, how the sugar acid weakens your tooth, makes you more prone to developing decay. Now, cavities don't grow overnight. It is a very gradual process. So when you have pain, when you have large cavities, it is a result of your neglect and lack of care. Because a cavity doesn't suddenly be large in size. It always begins as a small sized cavity, something that keeps growing with time. So it is in your control to get it fixed when it is in that initial stage with your routine dental visits. When a cavity is in its initial stage, the treatment is pretty basic. All we do is we clean out the decay and we put a tooth colored cement filling material in the tooth. What happens when you don't do this? Like I said, your cavity will keep getting larger and larger and larger in size, to the point where it causes severe sensitivity, pain, swelling. You will not be able to chew your food. Sometimes the infection becomes so bad that the infection spreads to your bones, it spreads through your muscles, and sometimes it can even go to the ear, and in worst cases, it can spread to the brain. If it spreads to the brain, it can even cause death. So it can be something that's severe, not something that has to be taken lightly at all. If, like I said, the tooth begins to cause pain or there is swelling, then you cannot expect your tooth to become all right with just a basic cavity filling, and then you're done and dusted with it. Then you're looking at bigger treatments. What do I mean by bigger treatments? Either you will need a root canal or you will have to remove your tooth itself because it cannot be saved. So, spotting your cavities in the initial stage is key, and this can only be done when your dentist spots it. That is only if you are regular with your dental visits. Second thing, what we see is your gum disease. What is gum disease? There'll be swelling in the gums, pain in the gums, redness, bleeding, and This can happen even when you're chewing basic soft food items. It doesn't even have to be hard food items. You'll see blood when you brush your teeth. You'll see blood when you bite into an apple. You'll see blood on the apple. So all these things are indicative of gum disease. What you need in most situations is a basic cleanup with probably either a gel medication or maybe a different toothpaste for gum disease, and you will be fine. But when you neglect this, what happens is you are already aware of how it affects the rest of the body, where the bacteria spreads everywhere. I'm not going to repeat all of that again. But when this worsens, gum disease becomes bone disease. When the bone gets affected, your bone becomes weak. Okay. And when the bone becomes weak, your tooth becomes loose. Tooth becomes loose, you lose your tooth. So that comes to a third point, that is tooth loss. So other ways in which tooth loss happens is trauma, accidents, if you've fallen and a tooth has broken, or if you've bitten something very hard and your tooth fractures because of that. So, tooth loss is another common oral health problem. What happens when you don't replace your missing teeth? You all already know that by now because I've mentioned it several times. You will not be able to chew your food. Your speech will get affected. Socially, it will make things very difficult for you. The fourth point that we have is that of oral cancer. Now, oral cancer is again a silent killer. Generally, when we dentists see oral cancer in the mouth, we see it as a very small boil or a very small ulcer. It'll look like a cut, and you will genuinely feel like it's just a cut, it's just an ulcer, it's nothing big. It'll be there for 1 week, 2 weeks, and you will probably keep ignoring it, thinking that it's nothing big, it will become okay with time. That then keeps spreading. It can spread to other parts in your mouth, it can spread to any part in your body. Now, the most common causes of cancer, what we see are tobacco, smoking or chewing, alcohol, a virus known as human papilloma virus. This I'm talking with respect to oral cancer. So these are the things that could lead to it. Now, what is important in cancer is catching on the disease early when it is still confined to a small part of your body before it spreads. Why? Because this makes survival better. There are statistics for this, of course. It is said that people in whom cancer is detected in early stages, they have 85% survival chances. And in individuals in whom cancer is noted in the later stages, once it has spread to other parts, their survival is as low as 20 to 30%. How can you spot cancer? You have to be vigilant. You have to look into your mouth when you brush your teeth, check your teeth, and most importantly, you have to see your dentist once in every 6 months because they are the best people to help detect any abnormalities in your mouth and they will advise you accordingly on what is to be done. The next point, that is the fifth point, what we see is halitosis or bad breath. Okay, how this happens, many reasons for it. I will describe the most common reasons to you. One is if you have gum disease and all the plaque or the dirt is collecting, this leads to bad breath. Second is if you've got cavities for a very long time and food is getting stuck in it and you're not cleaning it properly, that also leads to bad breath. Now, there are some medical problems also which can cause bad breath. Diabetes, liver disease, lung infections, which are there for very long. These kind of patients develop a foul breath. They might have very clean mouths. They might be very regular with their dental appointments or dental visits, but they will still have bad breath. In this case, it is nothing to do with poor maintenance, but because of other medical problems. So, your halitosis can serve as an indicator to help detect other medical problems. Who will help you with this? Your dentist and your physician. So that's another thing. Also, some patients have dry mouth. Now, dry mouth, either you're drinking less water, so you have a dry, parched mouth. Second is some people have a problem with the glands that produce saliva. They have dry mouths. Older people have dry mouths. People who are undergoing radiation therapy because of cancer, they have dry mouths. So all these people are more prone to developing halitosis. Now, the treatment for halitosis depends on what is causing it. If it's your cavities, if it's your plaque and tartar, of course you have to see your dentist for the cleaning, cavity filling, etc. If it's a medical problem, you have to seek medical assistance from your physician. Okay, if it is something to do with water, you have to ensure you're well hydrated so that the bad breath issue is resolved, because bad breath can be a little put you in a very awkward situation socially, because people might not want to socialize with you. You will again have some consciousness that comes into the picture. Socially, you will feel awkward. You will distance yourself because of it. So, this is something that you have to take care of. And the last most common oral health problem is what we call as malocclusion. What is malocclusion? Malocclusion is basically when your teeth are not arranged properly. Okay, to put it across in simple terms. Now, this can be anything like the picture in the slide, where you're seeing the teeth are crooked, some teeth are placed on top, some teeth are placed lower down. Then it can be spaces between your teeth. There are some people who have their teeth proclined outside, okay, because of which they can't close their lips and mouth. All this is basically malocclusion. How does malocclusion affect? What I generally see in my practice is that most people come to me with malocclusion problems only because they don't like the way how their smile looks. But like I mentioned in the first slide, your mouth and your teeth are more than just your smile. It is a gateway to your overall health. So there's no harm in coming and seeking help from a dentist to make your smile better, but you should also think of the other problems that can arise if you are not treating malocclusion. What are the common problems that can happen? You will have difficulty in chewing your food. Okay, when you're chewing your food, there'll be too much forces that are coming, which is not good because your teeth can fracture or break because of that. You can get pain in the joint, that is your mouth joint. You can have frequent headaches. Okay, these headaches, I have seen some patients with severe sharp shooting headaches, which no medication can make okay. Physicians find it difficult to diagnose because they concentrate on headaches because of cold, headaches due to migraine, or any other issues to do with the head. But nobody really concentrates on the teeth. And that goes undiagnosed. The patients become so furious with that headache that they are literally popping pills every day for headache, which is not good. So this is something that is noteworthy, that your teeth can also cause frequent headaches if they are not in the proper alignment. So this is one of the major reasons why you need to get your faulty alignment of the tooth rectified. And of course, the last thing is that it can be a little embarrassing socially if your teeth are not aligned properly, can make things a little awkward, makes you more prone to cavities. So this is what we will sum up for with terms of malocclusion. Now, consequences of poor oral health. Most of it I have already explained through the slides that we have discussed, but I'll quickly just mention all of them again. First, we know is pain and infection. Any of your problems can cause you pain, difficulty chewing, infection spreading from mouth to other body parts, difficulty eating and speaking, again, something that we have talked about. All of this leads to a poor quality of life. The third point, that is financial burden of treatment, is something that I would like to emphasize a little on out of all these points. Many patients say dental treatment is expensive, or coming to a dentist is an expensive affair. Let me be very frank with you and just make one statement that I tell my patients who tell me this. Dentistry is not expensive. Your neglect is expensive. If you are regular with your dental checkups, if you are seeing your dentist regularly every 6 months, the max that you will need is your basic cleanup and maybe a small cavity filling here or there. When you are neglecting these minor issues become major issues. Root canal, removal, removal के बाद replacement. These are advanced treatments. Of course, advanced treatments are going to cost you more than your basic treatment. So whose fault is it that you are requiring advanced treatments? It's your neglect, right? So financial burden increases when the complexity of the treatment increases. That is why it is important to take care. Prevention is better than cure. So be regular with your follow-up visits. Go every 6 months to your dentist. If there is nothing wrong, obviously there will be no treatment done, but at least everything is being monitored. We'll be keeping a tab on your progress. So financial burden of treatment comes into the picture when neglect has happened. So don't neglect your dental health. Be regular with it to save yourself from the financial burden that can follow if you're not taking care of your teeth. Now, I've told you prevention is better than cure and you have to take care of your teeth. But how do you take care of your teeth? That is exactly what we are going to discuss in this slide. That is the preventive measures which will help you have better teeth, better gums, a better mouth in general, which in turn will give you better overall health. So the first point, I'm sure everybody knows this and I don't even have to tell you this, but that is you have to brush twice a day, in the morning when you wake up and at night before going to bed after your dinner. Very, very important. Okay. You have to brush your teeth twice a day with fluoride. There's a very common saying for us in dentistry: brush in the morning if you want to keep your friends, that is to remove the bad morning breath away. Brush in the night if you want to keep your teeth, because if you do not brush at night, you are at risk of developing major dental problems. So anyone above the age of 2, I'm talking about kids also, kids above 2 years, and of course all adults have to use a toothpaste which has fluoride in it. Kids below 2 years, I recommend the toothpaste without fluoride simply because they cannot spit out. Why, I will tell you this in the next slide. So brush twice with a fluoride toothpaste. Next is flossing or cleaning between teeth. Many people do not do this, but you should do this. You must do this. Reason for this is your toothbrush cannot remove the food that is stuck in the gap between your teeth. You need something thin to pass through this gap and help clean these spaces. What happens when you're not removing the food between the teeth gaps is you start developing cavities in these junctions. People mostly come and tell me, Doctor, I'm brushing twice a day. Why am I getting cavities? I ask them one question: do you floss? So if you floss, the likelihood of you developing cavities is very less. Again, I wouldn't say zero because there are many factors that contribute to cavity formation. But if you do your bit, your chances of developing these conditions are far, far lesser than those who do not. So floss your teeth. You can use a floss thread. You can use a floss stick. And nowadays we have something new known as water flossers, very available in your pharmacies over the counter, very easily available on Amazon. So if you all want to know more about what water flossers are, you could probably reach out to me after the session is done, and I will share some links where you all could start incorporating this into your nighttime brushing routine to help make your oral health better. Next, we already know balanced diet. That is, you have to consume everything well, your carbohydrates, proteins, fats, vitamins, minerals, all in proper proportions. You cannot have more carbohydrates, less proteins, or vice versa. Everything has to be in the recommended proportions. Okay, and of course, you have to reduce your sugar, reduce your acid consumption to help keep the tooth away from acid attack and help prevent cavities. Next is regular dental checkups. What we advise is a biannual visit to your dentist. That is once in every 6 months. Now, in people who have very poor oral health or in people who have high uncontrolled diabetes and Maintenance is a challenge for them. For such patients, we recommend once in every 4 months because we have to put in additional efforts to ensure that their oral health is good. So, based on what your medical condition is like, it could be either once in 4 months or once in 6 months, like we see for most individuals. And the last point is, of course, avoid tobacco and alcohol. We know why, because it can discolor your teeth, stain them badly, break them down, and most importantly, it's a major contributing factor for oral cancer. Now, one miracle ingredient in dentistry, I would say for us, is fluoride. What is fluoride? Basically, it's a mineral and it's available very easily in its natural form through whatever food items we consume. Now, why fluoride is important? Remember, I mentioned the acid that attacks the tooth and weakens the tooth. Fluoride strengthens the tooth. So whatever enamel has been attacked or has been compromised because of acid, your fluoride will come in and impart some amount of strength to it, thereby making it in a better, healthier condition. So fluoride is a savior for your teeth. It will help strengthen your teeth, decrease the likelihood of cavities. Sometimes, like I said, a cavity doesn't form overnight. You will not suddenly have a big hole in your tooth. It starts very slowly. So, in the starting stage, when a cavity is just forming, you might not even see a hole in your tooth. All you will see is a small white patch on the tooth or a small brown patch on the tooth without an actual hole in it. Your fluoride, in such cases where there is a white patch or a brown patch, it can stop the cavity at that stage and prevent it from getting bigger, provided you are regular with your visit and your dentist spots this for you. If you're not regular, we will never spot the stage because you'll be way past that and you will actually have a hole in your tooth. So when cavities are in this initial stage, we can prevent it and we can stop it from growing with the help of certain dental treatments that we render, which involves the use of fluoride. Now, fluoride is also very safe and effective. Okay. Uh, People, what I see in my practices, some of them follow a very healthy lifestyle, like they are into yoga, they have vegan food, only organic items. And I have had a few people in my practice come and tell me, Doctor, you recommend using a fluoride toothpaste, but fluoride is toxic. So I cannot use it because it's not good for my body. Fluoride is toxic when it is consumed in proportions that are not recommended. Now, for a child to develop poisoning or toxicity because of fluoride, they have to consume 75 milligrams of fluoride. For adults, they have to consume 300 to 350 milligrams of fluoride to face fluoride poisoning or fluoride toxicity. Now I'm sure all of you must be thinking, doctor, from a toothpaste, how can we measure 75 milligrams and 300 milligrams? Obviously, right? You cannot because it's all mixed in the tube. I'll make it very simple for you all. 75 milligrams of fluoride is equal to 3/4 of a toothpaste tube or 100 grams of a toothpaste tube. 300 to 350 milligrams of fluoride is 3 full toothpaste tubes. One question. Is any of you at any point going to consume, swallow 3 tubes of toothpaste? Is any child going to swallow 3/4 or a whole 100 grams of a toothpaste tube? Obviously not, right? An adult would definitely not do it, and a child is always going to be supervised by an adult. So there is no way that a child can do this either. So does the question of fluoride toxicity really sound practical or come into the picture when it comes to maintaining your teeth? How much of toothpaste do you use in one session of brushing? This much? A pea-sized or two pea sizes? That's it, right? And are you swallowing it? No, you're spitting it out. So how can you develop toxicity? And that's exactly why I said kids below 2 years or kids who cannot spit have to use a non-fluoridated toothpaste so that at least their teeth can get clean. But because they are not spitting out yet, we don't want them to swallow that fluoride. But in a child who can spit or in an adult, do you think toxicity is possible? Obviously not, right? So this is why it's very important to incorporate fluoride into your brushing routine because it is toxic in alarming doses, which I don't think any person in their sound mind would consume. Some of the sources for fluoride is your fish, your meat, eggs, tea leaves, and another thing that I have mentioned here is fluoridation. What is fluoridation? Basically, whatever drinking water is provided to us, the government bodies add some amount of fluoride to that so that each time we consume water, we are also consuming fluoride. So this is fluoridation, and this is a very good initiative by government authorities to ensure that everybody is getting their dose of fluoride. Now, in some people, just this dose is not sufficient. They need more. Why? Because they have more problems in their mouth. Maybe old people who have dry mouths or old people with more cavities who can't clean it. People who have a lot of sugar or acid in their diet. People who have medical problems because of which, their mouth is going dry. All these people need a booster dose of fluoride. What is that booster dose of fluoride? It can be a fluoride mouthwash, it can be a toothpaste, it can be a gel or supplement. So we have some lozenges of fluoride or we have tablets of fluoride which you will probably have to take once a day or twice a day depending on the dosage required for you. And the last thing that we have is treatment. What are these treatments? We see you in the dental clinic and we apply something known as a fluoride varnish. It's basically a thin liquid which we coat over your tooth surfaces by following a certain procedure and we let it set there. What this does is it gives your tooth a protective barrier and helps prevent the formation of cavities. So anyone with a poor diet, anyone with a dry mouth, or people who cannot maintain adequate oral health, this is something that you should consider getting done by your dentist because it will help protect your teeth to quite an extent. Now, your diet and oral health. Again, the same point repeated again that you have to limit your sugary food consumption and your acidic food. Eat a lot of calcium rich foods. What does this include? Milk, yogurt, cheese, then a lot of fibrous foods like your apples, carrots, broccoli. All these things help maintain optimum oral health. Fish also is very good, especially cod liver oil capsules is something that really helps maintain not just good oral health, but it maintains the health of your skin, your bones, your hair, etc. And last is, of course, you have to stay hydrated with water. Drinking water is important because it keeps your mouth moist. If your mouth is moist, of course, lesser chances of cavities. And when you gargle with water, it removes the particles of food stuck in. So that again helps keep cavities at bay. Now we will come to some myths versus facts. What is this basically? This is basically something that people have as a common understanding and whether it is true or not. Some people say that only kids can get cavities, which is false. Anybody with teeth in their mouth can develop cavities. It can be a child who's got new teeth as old as 6 months or 1 year, or it can be someone who is even as old as being in their 90s. Second myth is brushing harder cleans better. This is the worst thing that anybody can ever tell you. Brushing harder means you are causing damage to your teeth with your own hands. That is wrong. Brushing forces have to be very gentle. If you scrub your teeth harder, they are not going to get any whiter or cleaner. You have to ensure you're using a soft toothbrush, a fluoride toothpaste, and when you brush, you will either give vertical motions or you will give circular motions because these don't put force on your teeth. When you do this, you're putting a lot of pressure which can result in tooth wear. So if you are doing any of these things, please stop. Visit your dentist, Learn the proper brushing technique. Next thing is, if gums bleed, I need to stop brushing or flossing. Wrong. The fact that your gums are bleeding, it means you already have gum disease and you have to go see your dentist and get that treated first. Because you have not been brushing, because you have not been flossing properly, your gums are bleeding. So first, go get a routine cleanup done by your dentist, learn the proper technique from them, and then maintain it at home following your dentist instructions. And the last thing is, cleaning or scaling makes the teeth weak. Again, that is wrong. Because you are not going to your dentist and getting your cleaning or scaling done, what happens is the dirt keeps collecting on the teeth. As the dirt collects on the teeth, your gums get weak, your bone gets weak. Bone gets weak, your tooth starts shaking and it becomes loose. So going to your dentist and cleaning the dirt is not what has made your tooth loose. It is your neglect which has left the dirt there, made your gums and bone weak, which has caused your teeth to shake and fall off. So all these are myths. Please don't go by these. If you need proper dental advice, you should only take that from your dentist, not from your neighbors, not from your friends, and most definitely not from Google. Google did not go to dental college, your dentist went there. So seek advice from qualified professionals only. Next, we will come to oral cancer awareness. I have already discussed the details about oral cancer, what causes it. Here, I will only tell you on what can be done to prevent it. Number one and two, we all already know, that is, you have to avoid alcohol and tobacco consumption because these are major triggers for your oral cancer. The next thing that we see is get vaccinated against HPV. What is HPV? It's basically human papilloma virus, one of the major causes or leading causes of oral cancer. The great news is we have vaccines available for HPV. So you should seek advice regarding this and get vaccinated because this gives you a fair chance at fighting cancer. The fourth point that we see is limit sun exposure. So, sun, that is your UV rays, ultraviolet rays, can cause cancer on any of the exposed parts. Your head, your neck, your exposed arms. If you're wearing clothing where your legs are exposed, that too you could develop cancer. But the most common site because of sun affecting a particular part is your cancer affecting the lips. So for the skin, exposed skin, we already know that sunscreens have to be used to help give you some protection against the ultraviolet rays. What can you do for your lips? You have lip balms with SPF, that is your sun protection factor in it. Start using these, they are healthy for you. And of course, you have to maintain a overall healthy lifestyle with proper health. Engage in some form of exercise. You don't necessarily have to go to the gym or join some fancy Pilates or yoga class. Go on walks, exercise at home, walk for 10 minutes after each meal. Even these minor basic things that you can do can make a huge impact on your life. So you don't always have to chase the big fancy things. Basic steps are also sufficient to help keep you in good health. Now we'll come to children's oral health. So kids need to see a dentist as soon as their first tooth erupts. It is the parents' duty to take a child to the dentist as soon as they see the first tooth in the mouth. Some parents be a little apprehensive, of course, because they feel like our baby is so small, we don't want to take her to the dentist. The max that you can push your child's first dental visit is when they are 1 year. The first tooth generally comes out by around 6 to 7 months. But if you're someone who's really apprehensive about it, you have to take your child latest by when they are 1 year because this is where we monitor your tooth health, your child's tooth health. What we commonly see in children is something that we see on the slide here, where the front teeth appear black. Why this happens is it is something known as nursing bottle caries. This does not mean that your child is eating a lot of sugar, a lot of chocolates. That is why it is happening. Because some parents wonder, my child is not having a lot of chocolates. Why has this happened to them? This is because of milk. So milk has got some amount of natural sugar to it. It can be breast milk, it can be bottle milk. What is the general tendency? We feed the child milk, we put the child to sleep without cleaning their gums, without cleaning their teeth. The sugar from the milk forms a coating on the gums and teeth, and it results in this. Does that mean you have to stop giving your child milk? No. It simply means you have to start cleaning your child's gum and teeth after you give them milk. How do you do it? Either with a silicone toothbrush or with a soft, clean muslin cloth or any clean handkerchief. You have to just dip it in water for infants, I'm saying, especially, or kids who cannot spit and cannot brush. Take a cloth, dip it in clean drinking water, and rub it on the gums, rub it on the teeth. Even if there are no teeth in the mouth, parents, you have to wipe your gums, your child's gums, to ensure that when they get their teeth, they do not look like this. And most importantly, teach them good oral hygiene habits, because whatever they learn as kids is what they carry with them through life. So this is something that you have to really concentrate on. Next, we come to elderly oral health. Like I said, we see many old people with no teeth. What is the first thing they come and tell me? Doctor, I am old. I am going to die any minute. Why should I have teeth? Why should I put teeth? Let it be. जैसे चल रहा है चलने दो. That is bad. Because this could be the very thing that compromises your life, compromises your nutrition, and might lead to early death. So, older people who feel like you don't need teeth, that is wrong. You have to put false teeth so that you can bite well, so that you get good nutrition, and so that you are healthy. Also, if anyone is having dry mouth, older individuals, it's important to seek help from your dentist, because repeated dry mouth, repeated cuts and ulcers because of dry mouth can over time develop into cancer. So, replacement of teeth, replacement with dentures, implants, anything is very important. And old people who are using dentures, it's very important to keep your dentures clean, because if there is any dirt on your denture, that dirt can enter your mouth. From your mouth, we know it can spread to any other body part as well. So hygiene is very important. Now, what is the role of us dentists in prevention? Of course, we know dentists are going to treat any dental problem that you go to them with. But like I said in my introduction, I am someone who focuses a lot on educating my patients, because still they don't have sound knowledge. They're obviously not going to be able to do much. So it is our job as dentists to educate and counsel you, to do the professional cleanup for you whenever you visit us, once in 4 months or once in 6 months, and to help spot diseases in the initial stage so that it does not get worse with time. Role of patients, of course, you have to brush twice, floss once, attend your regular visits, and follow whatever we recommend you to. If we are going to give you all the possible knowledge or education in the world, but if you're not going to take it up, if you're not going to act on it, everything that we have told you is an absolute waste, because we can manage you in the clinic, we can educate you in the clinic. We are not there at your home to constantly guide you and tell you what to do. It is up to you to take up that advice and follow it well and to act on it. So, what are the key takeaways of today's discussion? That your oral health and overall health are equally important. In fact, they are inseparable. If one is affected, by default, the other is also going to get affected. Next, prevention is obviously better than cure, because you will need lesser invasive treatments, more basic treatments than advanced complex treatments. Your small daily habits matter. Maybe if someone just in your family or your friend circle sees you taking care of your teeth, maintaining your teeth well, that could motivate them to take up good habits. So you are becoming a positive influence on society and for others, which is huge, which is very important, because that is what we are here for. We are here to create awareness. So your small daily habits can lead to big wins, not only for you, but even for the people around you. And last but not the least, please visit your dentist regularly, minimum once in every 6 months. Now that we are done with the session, I would just very briefly like to tell you a little about my practice, Dent Health, that was established by me. It is located in Bacola, Santa Cruz East. So I've got over 8 years of experience, but in these 8 years, the one thing that has always been of primary focus to me is patient counseling, education, preventive measures, and looking at the patient on the whole, not just their mouth, but to see how my treatment can make their overall life better. And another thing is, how can I make my patient comfortable? Because most people are just scared of going to dentist, and that's the reason why their oral health gets neglected. They've heard things from others कि इंजेक्शन देंगे ये होगा पेन होता है but don't go by others' experiences. Take it upon yourself to go and experience things yourself. Our focus at Dent Health is to make the treatment as comfortable as possible for our patients. Am I saying that you won't feel a thing? No. But we counsel you, we advise you on what we are going to do, what is going to be done, so that you are mentally prepared and you're better equipped to go through the process and to, of course, make it as pain free as possible so that you are happier and more comfortable receiving your treatment. So, like I said, more of a prevention based approach and more holistic, where we want to integrate your overall health and your oral health and your overall health as well. And most importantly is we cater to all age groups. That is, they could be kids who are just 1 or 2 years or even younger, and even older individuals who are in their 90s. And I actually have patients that old who come to me for implants and dental treatments. These are just some of the case pictures done by me at the clinic. You can see missing teeth, worn away teeth replaced with new teeth in the after images before. Then again, starting from the top left, a patient with no teeth at all given a complete set. The top middle picture, again a broken fractured tooth replaced with artificial teeth. The top right corner is a patient who wanted teeth whitening done. Then on your bottom left, we have a patient who had a space between their two teeth. He did not like it, so I replaced that space with some filling. And the last picture, that is your bottom right corner, this is what a basic cleaning and polishing can do to you. Can you see all the brown marks are gone? How the teeth are looking cleaner? So this is what dental treatment can do to you. This is how it can boost your confidence and give you a healthier life. So please uh, focus on your oral health like you focus on your overall health, because like I said, it's inseparable, and for you to enjoy life, a good quality of life, everything needs to be not just aesthetic but also functional. Your mouth is more than just your smile, it's a gateway to your overall health. So I hope today's session was useful in educating you all, and I hope you all have managed to take away something from this. And now that we're done with the session, I would be very happy to take any questions from you all, if any.
As Thank you so much, ma'am. Firstly, as there are a few questions on the chat board. First question is from Vikas Patil. So he has
Okay.
questioned that what type of toothbrush and toothpaste should I be using available in the market? Can you mention brand and names?
Yes, definitely. So when I say the type of toothbrush, it has to be a soft toothbrush. That is point number one. Point number two, ensure that the head of the toothbrush, what is the head of the toothbrush? जहाँ पे bristles होते हैं, वो ज़्यादा बड़ा नहीं होना चाहिए. So it should be a small head toothbrush, something that will easily reach the corners of your mouth with soft bristles. Your brushing stroke, like I said, should be vertical or circular. Coming to your toothpaste type or your brands like you have specified for, I'm not here promoting any brand, but I will tell you the good brands for day-to-day use. You can use Colgate Total, you can use your normal Colgate, you can use your normal Pepsodent toothpaste. I can tell you toothpaste which you should never use in life. Any whitening toothpaste, any charcoal toothpaste, toothpaste with salt, namak wala toothpaste. Nowadays there is this new marketing gimmick of purple toothpaste which they claim makes your teeth white. That is again something that you should refrain from using. Your herbal toothpaste, Ayurvedic toothpaste, all these things are a absolute no-no because what this does is in the long term it damages your teeth. So this should not be used. So coming back to your question, a soft toothbrush with a small head and your basic toothpaste which has fluoride in it is good enough for you. I hope that answers your question well, Vikas.
There's a second question from Naeem Zikri. Three types of brush available in market: soft, medium, and hard. Which one to be used? How to decide it?
Soft toothbrush, medium and hard is not meant to be used for your teeth. I honestly don't even know why these brands are manufacturing medium and hard toothpaste because it is so bad for your health. So only a soft toothbrush is what I would advise.
There's one more question. Ria Chabria has asked, they say milk is a good source of calcium. Is it true or myth? Or does not like milk, do we need to start calcium supplements?
So there might be a requirement for calcium supplements for your child, but for me to comment on the dosage is not possible because we first need to understand where your child's calcium levels are at. If there is a deficiency, then the calcium will have to be started. And if yes, then your physician is the best person who will be able to recommend the dosage for you based on what your child's current calcium levels are.
Another question is by Suresh Menon, sir. Does bad oral health causes disease like fatty liver or any liver disorder? Brand Oral-B toothpaste is good or Colgate salt is better?
Okay, so oral health and liver disease is interrelated in the sense how I explained in my presentation, where your bacteria can spread to that particular organ. Now, what we see with liver diseases is sometimes even liver diseases that go unnoticed, the patients give oral signs of it. They will have poor oral health, breakdown in the gums, they will have a foul odor. So, yeah, it is a little interrelated. It probably won't specifically cause fatty liver, but it can aggravate the fatty liver because of the inflammation and the bacteria that will spread from your mouth to the liver. Coming to part two of your question, brand Oral B toothpaste is good or Colgate salt is better. I don't recommend Colgate salt because salt is abrasive. Anything abrasive in your toothpaste can cause damage of your tooth surface. So, like I mentioned earlier, any toothpaste which has salt, any toothpaste that has herbal products in it, or your charcoal toothpaste, these are not good. Stick to a basic toothpaste that has fluoride in it. How much fluoride is needed for adults? If you check your toothpaste tube, it should have 1000 to 1500 ppm. What does ppm stand for? It stands for parts per million. So it should have that much fluoride in it. That will be good, and that is the recommended dose for anyone above the age of 6 years.
Okay. The other question is from Shania Mago. Nowadays, all food items are adulterated as there is also use of chemical in washing of fruits, vegetables. How to avoid impact of harmful inputs?
Okay, very, very simple. These are literally routine household tips. First is rinse it thoroughly under running tap water. Second is keep the fruits slash vegetables soaked in salt water for some time because we all know salt has antibacterial effects and it also helps remove any harmful chemicals. Another common thing that can be done for berries and fruits like grapes, strawberries, cherries is in your water along with salt you could add some soda bicarbonate to it. What this does is, if there are any tiny germs or any stubborn chemicals stuck to the fruit or vegetable surfaces, it helps cleanse all this out. Keep it immersed in it for some time. After that, rinse it with water again, and then it is safe for consumption.
Okay, the other question is from Delis ma'am. Is it good to use mouthwash frequently? Also, kindly recommend how frequently can dental flosses be used?
Okay, I'll answer your second question first. That how frequently can dental floss be used? Dental floss has to be used daily, once at night. So the routine that you will follow is, of course, in the morning you brush your teeth and then you go about your routine. At night you have your dinner. After dinner, wait for a minimum of 30 minutes. You should never brush your teeth immediately after eating, because just after eating, acid level is very high in the mouth. And like I mentioned in my presentation earlier, that when acid touches the teeth, it makes it weak, and then the whole cycle of cavities and other damage starts. So minimum 30-minute waiting period is required post your meal consumption. Once you waited for 30 minutes, you will first floss. So you will run the floss between all the gaps of your natural teeth, or all the junctions of your natural teeth, and then you will brush your teeth. So flossing first, once daily at night after dinner, followed by your brushing after that. And the other part of the question, is it good to use mouthwash frequently? Mouthwash use, frankly speaking, is not something that I recommend all my patients to do. There's a very simple reason for this. Our mouth has bacteria. Now, there are both types of bacteria in the mouth. There is good bacteria, there is also bad bacteria. Mouthwash does not identify what is good and what is bad. Mouthwash destroys everything. So, in the process of destroying the bad bacteria, you are also destroying the good bacteria that is required. So, I do not recommend mouthwash use frequently. The only time I advise my patients to use mouthwash is if they have some infection, if I have performed a surgery in their mouth, or if they have undergone a particular treatment which requires a mouthwash use. So there is no one generalized mouthwash that can be used by everybody. It depends on the treatment required and the problem basis which we dentists decide what is good for you.
Okay, there is a question by Mr. Zainul. Invisalign or braces, which one is better for teeth?
Okay, so both are good. Let me begin with that. Your end result is going to be fabulous with both, where you will have perfectly aligned teeth. Now, how do I advise in my clinic on Invisalign or braces? Number one is you have to see what your oral hygiene maintenance is like. Someone who does a good job at maintaining teeth hygiene, or in general mouth hygiene, they can consider braces. However, braces do come with, I would say, some disadvantages with it. This is more to do with the diet. So you can't have hard things, you cannot have sticky chewy things. Why? Because in braces we stick something on your teeth, so there is a possibility that these can break or they can come out, and you have to keep visiting us to get it refixed. So dietary restrictions are in place. Also, you have to start brushing your teeth thrice a day then, because with braces, chances of food getting stuck becomes more. In that case, Invisalign is better. Why? Because for Invisalign, you wear it the whole time and it is removable. So whenever you want to eat something, you have to just take it out. So you're free to eat anything and everything that you like. Also, maintenance becomes very easy. So when you have Invisalign, you remove that, you clean your teeth, you wash your aligner underwater, and you wear it again. So treatment result wise, I wouldn't say one is better than the other. Both are the same, both give you good results, but it is the process that makes one better than the other. Invisalign is easier for the patients to maintain. So, comfort wise, maintenance wise, Invisalign is better than braces. Treatment wise, both are the same.
Okay, the other question is asked by Vijay Vishwakarma. Is there any age limit for use of braces?
Not really. Braces can be done on anyone. We have treatments going on for kids, teenagers, and I even have patients who are in their 40s and 50s who are undergoing braces treatment. So braces can be done for anyone. The only criteria is we have to check for your bone health and your overall dental health, and then we take a call on whether you can go ahead for it or not and what your case requirement is. As such, there is no age limit unless you are having some other medical problems or other bone problems because of which we cannot do braces for you. But the sooner the better, because in younger patients the progress of braces treatment is faster than it is for older patients.
Okay. As I think so, dear Sumit sir, you have any question? I think
Yeah,
so.
yeah, I have so many questions.
Okay, sir.
So first of all, Ransala ma'am, amazing presentation, amazing insight, and we are very, very honored to have you give this presentation. It's actually opened so many questions for me that you'll have to give me a couple of minutes. So starting about toothpaste, meswak, what do you categorize meswak as? Is it a herbal or a Ayurvedic byproduct? Because typically it doesn't have any abrasive substances within the paste. So you still categorize it there, or is it okay?
It does have abrasives in it.
Okay,
All toothpaste have abrasives in it because
okay,
without an abrasive, there will never be cleaning action. The
right.
cleaning action happens with the abrasives. So why I don't generally advise miswak is because it is a little harsh on
Okay,
the teeth. So
perf-
I wouldn't advise use of that.
perfect.
Any toothpaste by default has abrasives, in
Perf-
short.
perfect. So my second question is tooth powder, the Colgate tooth powder. It every time I use the tooth powder, it's amazing results. The teeth feel so fresh, but it feels very, very
Pretty.
strong. Yeah. So how is it good or is it doing harm?
Stop using it. That is all that
Stop
I will
using
say.
it.
Stop using it.
Okay. Bad breath. How do you take care of bad breath? What's the primary one reason? Second is it because of oral or is it also to do with the body health?
Okay. How do you manage oral health? The base halitosis, bad breath, basically. The most basic thing that you can do is you have to brush twice, you have to floss once, and your 6 monthly dental cleanup. Like I said, dirt formation happens in everybody. There is no escaping this. It forms in everyone. It is up to us to go see a dentist to get it removed. Now, when this dirt is not removed for prolonged periods, it can cause bad breath. In this case, all you will need is a basic cleaner. Patients who have bad breath because of cavities, food getting stuck there, you have to get the cavity filled and treated. Your bad breath problem will get resolved. Now there are some who maintain oral health perfectly well. ना ही cavities है, ना ही plaque है, फिर भी bad breath का problem नहीं उनको. This could be because of mouth dryness. So we have moisturizers for the mouth also that can be used. We have common brands are something known as Ormist. It's a spray. And there is another mouthwash known as Saleva. That is also a moisturizing mouthwash. So people with dry mouth can use this. Now, if it is a medical problem, it can be because of diabetes, it can be because of liver problem, it can be because of long-term lung infections. So if your mouth is healthy, if you don't have dry mouth and you still have bad breath, that means after your dental visit, your dentist will refer you to a physician to get your other bodily problems sorted so that your bad breath issue is resolved as an outcome of that
Perfect.
treatment.
I have one more question, ma'am. At least three more. So instead of washing in salt is washing in vinegar good for the veggies, or it's a no-no?
It is okay to do, but salt is preferred because of its antibacterial effect and it is more safer. Vinegar in the end is acetic acid. It's an acid.
Okay.
It's not that it is bad. It's not that you cannot use it. Maybe in smaller proportions with salt will do a better job. But then ensure to rinse it very thoroughly after soaking it in vinegar. Otherwise, you will feel the aftertaste of vinegar
Perfect.
as a coating on your fruits and vegetables.
Perfect. How many times should one person brush in a day?
Twice.
That's it.
That is the golden rule. Twice a day, brushing duration should be no more than 2 to 2.5 minutes, unless you are somebody who has got braces stuck to the teeth. In these patients, we sometimes recommend thrice because maintenance becomes a little challenging with only twice a day brushing. So probably only braces patients thrice a day, everybody else twice, morning before when you get up before your breakfast. Second is at night, minimum 30 minutes after dinner.
Overbrushing 4 times a day will cause damage.
Absolutely. It will cause tooth wear and you will develop sensitivity issues for which you might either require filling or even a root canal if the situation is very bad.
Right. My last question, ma'am. Betadine is something that you all always give. So instead of a mouthwash, a betadine gargle, does it solve the same purpose, and is it advisable and safe?
Betadine is completely safe. It is also advisable, but not for everyday use. It
Okay.
is advisable when you have sore throat. It is advisable if you have undergone a dental surgery, for which I need you to maintain the area perfectly clean and to ensure कि reinfection ना हो जाए. Why I don't recommend everyday betadine use is betadine is dark brown in color. It
Right.
stains your teeth.
Right. Okay.
That is why daily use not advised, but as prescribed by the dentist, perfectly safe and very good antibacterial effects.
One last one, ma'am. I have a lot of chai. So tea stains, how do you avoid? Is there some magic trick gargling with ABC which does the trick for tea stains?
So, first of all, you will have to limit your consumption of tea
Okay.
because more than the stains, tea is acidic, and we saw what acid can do to your teeth.
Right.
What an easy tip to follow is make the cup size smaller.
Okay.
So your quantity automatically decreases that way. Second thing is, of course, gargle vigorously after consuming your tea so that whatever little
Okay.
film is formed on your teeth gets washed away. And when you see your dentist for your 6 monthly cleanup,
Yeah.
those stains will go with the cleaning and polishing.
Perfect. That's all I had, ma'am. Thank you so much. It was amazing insight, amazing session. Perfect, ma'am.
I
Thank you.
see one more question on
Yeah.
the chat box. Is it necessary to check ADA seal of approval when choosing our toothpaste? Please comment. So, for us in India, it will not be ADA because ADA stands for American Dental Association. We have to see IDA, that is Indian Dental Association. And yes, this seal is important. So, your toothpaste should have your fluoride levels of 1000 to 1500 ppm, like I mentioned before, and an Indian Dental Association approval has to be on it.
Okay. Now I will request each and every participation who have participated, have any questions, can unmute yourself and ask.
Hi, Dr. Ansela. Thank you for the lovely session. This is Delis here. I have one more question that nowadays, what is recommended for filling of the cavities? Because my experience is that, earlier I have heard, and even I have it, my premolars are filled with a silver cavity, and you won't believe it's like perfectly good. But also, I have seen that the younger ones who have cavity fillings, I don't know what is used, but it usually comes off. So nowadays, you are not using those silver fillings, or what is being used so that, in future, if we have to go for it, what should be done?
Okay. So, the reason we dentists have stopped using silver fillings is because we've been recommended against it. Now, these silver fillings, a part of it has mercury in it, and some studies have been conducted where they say that this mercury can have long-term toxic effects on the body. That is the only reason why silver fillings have been discontinued in clinics in today's times. I would say if you visit 10 dentists, you might probably just find one dentist who still keeps silver fillings. But like I said, we have been advised by our dental association to not use it. Now, these silver fillings, yes, I completely agree with you. They used to last for years and years together. But there is another hidden drawback of these silver fillings is because they last that long, there is slowly cavity formation that happens underneath that. And God forbid that one day where it breaks off, it's not just the cement that has broken off, but your tooth will probably also require a root canal, because there's lot of damage that has happened underneath, which has gone unnoticed because your cement has been perfectly fine over the years. So basis my experience, this is what I see very frequently in my clinic. What we use nowadays, there are two cements available. Number one is what we call as composite fillings or composite restorations, and the second thing, what we call is something known as glass ionomer cement, GIC. For our fillings, GIC we mostly use in kids or in sticking caps. Composite is what we widely used for placing cements. Advantages of it is very safe, it looks like your tooth, so it gives a very natural look. And I would say it is reasonably strong. It is obviously not stronger than your natural tooth, and there is a reason why it's not made stronger than your natural tooth. Suppose you have a tooth with filling in it, and say you bite on something very hard, we want the cement to break and not your tooth to break. Now, if your cement and the tooth have the same strength, both will break off easily. When your tooth cement filling is weaker than the natural tooth, we are okay with your cement breaking because we can put another cement for you again. If your tooth breaks, we are risking removal. So what you're saying that, like, the cement comes off easily is not, I would say, a drawback of the tooth. Of course, there are different situations. Each tooth is different. Sometimes the damage is too much. That's why the cement is coming out every time. Sometimes I mentioned malaligned teeth in my presentation where the teeth are not arranged properly. Sometimes this faulty arrangement of the teeth also causes the cement to come out. So it's not the fault of the dentist, it's not the fault of the patient, neither is it the fault of the material. Maybe the teeth arrangement is only such which is causing this frequent removal to happen. So, your composite fillings that are done in today's times are very good, very safe, and like I said, there are no underlying harmful effects like mercury presence or anything in it. And the cause for the frequent coming out of the cement would have to be studied by checking the bite of the patient, because maybe the patient has a faulty bite that is resulting in frequent fracture every time. I hope that answers your question.
Thank you so much, doctor. Thank you.
Great. Anybody else have any questions?
No question. If ma'am can share her, how do we get to her on the chat ID, either a number or a booking kind of an email, it'll help us get to her.
So I'm sharing my clinic number and my number on the chat ID, that is 9930081884
Right.
70210
Perfect.
So these are my clinic number and my number. You all can reach out to me or my assistants if you all seek a consultation with me, or if you all have any dental concerns that need to be addressed. I'm based in Vakola, Santa Cruz East. Landmark is near Vakola Masjid, and I'm also available on Facebook and Instagram, and my clinic is listed on Google as well. So y'all could also use any of these social media platforms or Google to reach out to me if y'all need any dental advice or an appointment.
Thank you, ma'am.
Dr. Rencella De Silva.
Yes.
Yeah, Piyush, over to you.
Yes, sir. Thank you. So we sincerely thank Dr. Ansel De Silva for delivering such an insightful and knowledgeable session on this important topic. I'm sure everyone gained valuable learning and awareness from today's discussion. Once again, thank you so much, ma'am.
It was a pleasure to be able to help in my little way. And thank you for giving me this opportunity to help educate all of you participants on your oral health awareness.
Thank you, ma'am. ICS is pleased to provide you all its research and development, integrated management system, QMS, EMS, OHMS, excellence in education management, ISO made easy in Gujarati, Marathi, Telugu, Hindi. For reading any of the above books, please contact Ms. Sushma Kindlekar. Feedback form. Please register on www.sadgunsang.org and go in your login and give feedback. Thank you for being a part of Sadgun on oral health awareness, a key to overall well-being. Feel free to contact us at. Okay. So we are closing our session for the day. Thank you, ma'am, once again, and thank you each and every participants. Thank you.
Thank you. Have a good day.